Well, good afternoon, UNT World faculty and staff. Thank you for joining us for today's virtual town hall to update you on how our system and universities are navigating challenges related to the coronavirus pandemic. I'm Paul Corliss, Chief Communications Officer for the UNT system, and I'll be moderating today's discussion. Joining me today are Chancellor Roe, UNT Dallas President Bob Mong, UNT President Neal Smatresk, UNT Health Science Center President Michael Williams, and UNT System Chief Human Capital Officer Barbara Abercrombie. These leaders have been tireless in their efforts to take proactive measures against the spread of COVID-19 while still fulfilling our mission to serve students. Thank you for joining us. And out of respect for these leaders' time, we will keep today's discussion to 90 minutes. As a reminder for those watching our live stream, the bulk of today's discussion will focus on questions that faculty and staff submitted to us through email. We'll get to as many questions as we can in these 90 minutes. With that said, let's jump in and get started with an update from each UNT system institution, and we'll start with Chancellor Roe. Chancellor, what can you share with us from a UNT system standpoint as an update?
Well, let's see. First, good afternoon, everyone, and thanks everyone for being with us today. I hope everyone is staying healthy. I ask everyone right up front here to take a breath. Remember to take a walk occasionally, connect visually with your coworkers. I think it really makes a difference that I get to see our team visually, through tools like this, and not just hear them and see how people are doing. It's nice to see the smiles. It lifts my spirits, and hopefully it will lift yours as well. We're getting inundated with news, and it can feel overwhelming, and so it's important to reach out when you're feeling isolated. We've shared through our communications various ways to do that. But today, Barbara, I'm sure, and our presidents as well will shed some more light on that if that's something of interest for folks. Paul, I would say in answer to your question on how are we navigating, our three presidents and the teams at our campuses and our vice chancellors, we're navigating this pandemic very well. I'm very thankful every day for this team, and that includes everyone on it. The responses have been just incredible. In what people have done. President Williams, President Smatresk, President Mong, I could not have imagined just a couple of months ago that we'd be facing a pandemic like this, and how rapidly each of you have responded to that. It's just been incredible. We have been meeting daily, multiple times a day to work issues, and thanks very much to our emergency response team. Steve Maricheski is starting early every morning with the cross-campus leads and getting information and issues, and then we can quickly work those issues. Steve has also been working with the state emergency team and city officials really daily, and our vice chancellors and our system teams are doing what needs to be done. Dan Tenney, Barbara Abercrombie, Alan Stuckey, Chris McCoy, Rosemary Haggett, Jack Morton, and you, Paul. Everybody's working those issues closely with our campuses and our coordinating board and our mayors and our governors, and really getting out the communications that is just so critical right now. Our Health Science Center is really reaching out to help the community during this crisis by answering calls and doing testing. You're going to hear more about that today from President Williams. I am so thankful to President Williams for being a healthcare leader for our community. We've all been keeping our eye on what is important, the health and safety of our students, our faculty, our staff. They all remain the top priority of our UNT system. And lately, what's been going on has really been changing hourly, but in Dallas-Fort Worth, our region has reported the largest number of COVID-19 cases in Texas, making it more important than ever that we're taking precautions designed to help reduce the spread of this virus so that our hospitals and our healthcare clinics aren't getting overwhelmed. And in line with Dallas County's new shelter-in-place rules, and now Collin County and Denton have followed suit. I think Tarrant just did moments before we joined. Everything have all gone in effect, and we've closed all of our UNT system administration offices for on-site access. But remote working is continuing. We're starting today with closing our 1901 Main Street in Dallas. We closed it starting last night, I should say, and it only has security staff there. Similarly, our UNT System Administration offices at our Business Service Center and our Woodhill Square and Discovery Park in Denton have limited on-site to designated personnel only. And I just want to be really clear, all of our UNT System Administration offices are only accessible to personnel designated as critical for on-site operations by either your Vice Chancellor or me. And then everyone else, all the other system administration personnel are continuing to work remotely. I want to thank everyone for your continued support and your response to this, the challenges that we've been facing with and taking these proactive measures for COVID-19, and so that we can limit the spread of it. And while still really fulfilling our mission to serve our students. So our UNT World values, our service, teamwork, trust, excellence, they're going to guide us through these challenging times. And I'll defer to each of our presidents to provide the latest at each of our campuses, Paul. So thank you for really making this town hall happen today.
No, thanks to everybody for joining us. President Smatresk, I'll hit the ball over to you, and can you give us the latest updates from our flagship institution?
Happy to do it. One of the things I have to start every meeting with is to say thank you so much to all of the people who've worked really hard to transform how we give instruction to our 39,000 plus students. And they've done it in a 2-week period. And it's kind of funny. Sometimes I think there's things we've wanted to do for the last 3 years, and we got them done in 2 weeks. Let me give you a rundown of what's happened. As of yesterday, we began instruction for 95+% of our students, which will shortly go to 100% of our students, fully online. That meant we had to convert 7,700 classes into online classes in a 2-week period. This is a Herculean effort. And the thing that I think is really important is that the brand of our university and our values, our resilient nature, our caring spirit, and our creativity all came to the fore as we joined hands, collaborated, and got this done. You know, so many times people feel higher education moves slow, but we did not move slow. And I know that's true for all of our colleagues. We moved this one fast. We did it effectively. And while we expect glitches and we expect some bumps in the road, I am really proud of how our faculty and staff have done, and they deserve an incredible display of appreciation from all of us. As far as where we are right now, we've moved to essential personnel only following this shelter-at-home order in Denton County. We were actually mostly there to begin with. We will have people who are providing students who are still in our residence halls. And while we're not clear on the final numbers because some folks are still moving out, we think it could be about 500 to 600 students who will remain in our residence halls at this time. Could be a little more, could be a little less. We will make sure that these students, many of whom are international students or have no other place to go, will be fed, and their residence halls will be taken care of with extra precautions to making sure that they're sanitary and that we're disinfecting on a regular basis. We also are providing essential services to students who don't have access to bandwidth or to technology through very limited library hours where they can check out or sign up for technology support to make sure that they can take their online classes. Again, we'll have a minimum number of people here responsible for protecting the grounds. Our police officers under Ed Reynolds' leadership are doing a fantastic job making sure the campus is safe, even though there aren't many people on it. And what I believe is that we have heard very, very few complaints about the kinds of things that are happening in terms of the distance education. Again, the biggest complaint is if too many people get on Zoom and run their video at once, everything gets a little wonky. So we're observing muticate, which means we always mute when we Zoom. Some of us are a little bit zoomed out because we Zoom meeting now almost more than we met previously. But I will tell you that the communication channels and our IT staff have done miracles. So all things considered, I'm proud of this, and I believe that this disruption signals a true change in the American higher education front, and I'm really excited to see where we go from here. Given the severity of the circumstances we have, That's the silver lining that we're looking for. Thank you.
No doubt, we're proud of all you guys have done in Denton to mobilize in the face of this pandemic. President Mong, can you give us an update on UNT Dallas, please?
Yes, thank you. First of all, I'd just like to say about our faculty, staff, and students, they've been very brave during this public health emergency. They've responded with a lot of improvisation and responsiveness, and I'm very grateful for them, for their responsiveness. So we are essentially, all of our physical offices are closed at the College of Law and our Southern Dallas campus, except for our police department. Our residence hall now is closed, and the students that remain there are now in a hotel nearby. Our 5 schools have all moved to virtual instruction. 100% of our faculty successfully completed this transition. And our goal really is to provide each of our students with the tools to enable them to complete the semester successfully and for our seniors to graduate. Our emphasis has been on engagement between our staff and faculty and students. We have hotlines for staff and faculty and hotlines for our students that are being answered and responded to. So we're also communicating daily, at least once a day, updating status reports, sending out frequently answered questions, asked questions, and updating them as need be. I think just talking among ourselves, we're a small campus, smallest in the system, and yet I think there's a sense of real solidarity. Almost 1 billion students worldwide, according to the World Health Organization, are now learning remotely from early grades to secondary to post-secondary. So, we're part of something much bigger. And while there are very difficult times, we're all in this together.
Well said, President Mong. Appreciate those words. President Williams, could you give us an update on UNT Health Science Center, please? We'll bear with him. We see him in the meeting. We'll maybe let him get an adjustment there from a technical standpoint. And while we wait on President Williams, I've got some questions. We've got. Are you there, President?
Yeah. Sorry, there's a small technical problem. Now we're back on.
Good to have you.
I think I'd echo what my colleagues have said. I think there's been amazing levels of collaboration and people working together. Lots of flexibility and willingness to take on tasks that were big lifts. Our team started talking about this probably in earnest 4 weeks ago, and then over the last 3 weeks began to take some very serious steps, from canceling large events to canceling off-campus groups that were coming on campus to schedule their meetings. We stopped the inflow of all visitors to our campus. And a couple weeks prior to that, we had already began steps towards what we were doing around travel. So we've done some things proactively, like the message you've heard from Dr. Smatresk and Bob Mong. I think it's all about proactivity and not reactive leadership, but being proactive. And I think all of us have tried to demonstrate that. But again, I want to echo what they've said. The levels of where people working together has just been amazing, and it's really gratifying to see that. As Neal said, some of the things that we consider to be a heavy lift 6 months ago, like moving to online education more and more, and some other aspects of that, was done by our faculty and staff and our deans and our provost in very short order. And so we are now all online. or those courses that can't be taught online. So some of our clinical courses are currently postponed, or we'll come back to visit that. Our clinical team did a fantastic job as well, moving all of our clinic visits to virtual visits. That's an effort to not only keep our patients safer, but also our staff and team on campus. We have, as the others have said, we sent vast majority of our team here home many days ago, and so we're down to just a very few today. And as the Chancellor alluded to, Tarrant County leadership announced this morning a shelter in place that will take effect at midnight tonight. And so it seems as though the entire Metroplex has kind of moved to the same level. One last thing I'd say is that I've been astounded, as Bob Mong said, by the volunteerism, the willingness of people to step up and help. The projects that we have taken on, there have been overwhelming numbers of people wanting to volunteer, much more than the number we could use. So it has really been a true coming together, and it's very gratifying and uplifting to see this happening at this time, under this time of crisis.
No doubt about it. The collaboration has been incredible across the system. President Williams, if you'll stay with me here, we're going to move into the next portion of our town hall here today. As many of you know watching along, Dr. Williams is not just a university president, he's also a physician. And Dr. Williams and other experts from HSC have been real leaders in Tarrant County as far as disseminating accurate information on COVID-19 to the public. There's been a lot of misinformation out there, and the efforts of HSC to provide real medically accurate and data-driven answers have made us all proud. With that in mind, President Williams, we're going to have a short Q&A with you about the virus from a medical standpoint. And the first question I guess I'd ask you is, how did we get here? How did this coronavirus situation become a pandemic?
Well, there's several aspects to understand. So the COVID-19 is the 19 piece of the name imparts a variant of a group of viruses. So as far as we know, there's about 7 coronaviruses, 2 of which you've heard of before, 3 of which you've heard before: the common cold, SARS, and MERS. COVID-19 is a different variant, and because it's one we've not seen before, it's considered novel. So it takes a novel or a new variant, typically that there's not any known immunity to begin a rapid spread, much like SARS and MERS did previously in the last 20 years plus. Spread is typically person to person. In this case, it's expected that it really went from animal to person. From the site, when it was first discovered the last day of 2019 in Wuhan, China, it was expected to have moved from an animal to an individual human, and then it goes person to person. One of the keys to having a pandemic is you have to have a virus that spreads easily, and this one spreads very quickly, again, because of the lack of immunity and as well as the way it's structured. And then lastly, to have a true pandemic versus an endemic, it needs to be impacting multiple countries. Typically, endemics are limited to regional areas or even one country. So that's in a sense, Paul, just maybe a short conversation about how the pandemic got started.
Could you give us, you touched a little bit on how the virus is spread, and we all know we're supposed to wash our hands and not touch people and whatnot in these situations, social distancing, but can you give us some specifics on how the virus is spread? I know it spreads easily, but what are some specifics? And for instance, how long does it last on various surfaces and whatnot?
So it spreads in what's called droplet to droplet or droplet spread, which means from a sneeze or a cough, typically. And that's why the social distancing of 6 to 10 feet is key, because that is a range outside the normal cough or sneeze spray if someone's not covering their mouth or nose. So it's a droplet spread, and that's why it's, we'll get back to this in a minute in terms of masks. But so when it is, then if someone sneezes on their hand or coughs on their hand and then touches the surface, the virus has the ability to attach itself to the surface and reside there. And the length of time it stays on that surface is really dependent upon the type of surface, the materials it's made out of, as well as the temperature and humidity of the surface. But it's all about staying on that surface from anywhere from a few hours, maybe even a few minutes even, to even several days. And so if you are not infected with the virus and you touch a surface that has been contaminated, and then you touch your face, especially your eyes, you can quickly spread the virus to yourself. And then because it spreads so quickly, we haven't really been able to determine exactly what the incubation period is, or the pre-period before you start having symptoms. We just know that a lot of people are able to spread the virus without any demonstration of symptoms because they've come in contact with it. Is that helpful to you?
Quite helpful, and wanted to just talk a little bit about the symptoms and the signs that you mentioned a little bit. Initially, we were told that this is much like the flu, but as new information comes out, I think we're getting more details about symptoms and signs.
So, the flu, as you know, every year comes out in variants, and that's why we also often have the issue of the flu vaccines of efficacy each year, because it's a best guess several months in advance of what kind of flu we're going to see during flu season. As we know, most flus have aching, and most of them commonly have sore throats and chills. This particular virus seems to be demonstrating more fever, dry cough, early fatigue, and shortness of breath. It's almost always a respiratory virus, but as what we call secondary level symptoms, you can have joint pain, you can have headaches, you can have sore throats and chills. Those are just not as frequent as the fever, dry cough, and shortness of breath. The patients that are getting extremely sick are by and large patients with congestive heart failure, respiratory disease, pre-existing, or obesity. And it is often because of the sensitivity of their respiratory system to hold on to an infection.
As it relates to getting tested, if I'm going to go in and get a test, how does that test work? And understanding there's relationships with labs where a sample may be sent, how quickly can you get a result from a test?
Well, these particular tests are developed. Why we don't have these tests pre-existing is because the tests are based on the genetic material and makeup of the virus. So you have to understand, this is one thing the Chinese did do very early on and shared, was the genetic makeup of the COVID-19 virus. Once the genetic makeup is known, then you can develop tests to try to pick up on that specific genetic material. And the way testing is being approached is we're seeing, first of all, we're seeing a problem with a lot of areas where they started testing everyone, and the testing kits have been really in limited supply. They're coming online faster and faster. In fact, if you look at the national numbers right now, the number of test kits this week are 10x what they were last week, and we expect by next week they could be 100x. The problem with the tests is right now is the 3 national labs who have been working feverishly to develop these tests and getting them out there and getting them in to run are Quest, CPL, and LabCorp. And so there's 2 parts to the test. One is you can do the swab. The second part is you have to have somebody who can actually run the test. So that's been another bottleneck as well. So for that reason, there's been a lot of prioritization in most testing sites for the most high-risk patients. They go through a very clear, clean screen to see if they're high risk, as well as access for testing for our first responders. And especially those other folks who were not considered high risk, but were already symptomatic. I just heard in the last 3 days, there is a company that has developed what we call a point of care test, which would take the turnaround time of the current test is anywhere from 4 to 6 or 7 days, which is problematic. This new test is what's called a point of care test, which means the results would be ready and read within 45 minutes. And it can be read on the spot, much like some of the tests we do now, like flu test, strep test, those kinds of things. So point of care testing will change access to testing for almost everyone.
Until we get to that point and have that point of care testing, how much will that impact our reporting numbers? It seems like we've heard because of this testing situation that many cases are going unreported because of the lack of tests.
So I think it's not only a lack of tests, it's also sophistication of the country. For example, there are second and third world countries who don't have access to testing, but yet we know the spread of the virus is in those areas, and so the expectation is the number is always higher than the number reported. So the number reported are the ones who have actually had a test and are positive. So I think two things to keep in mind. One is that number is always going to reflect a lower number. It's always going to be a lagging number because this virus is moving so quickly. But also understanding the countries that don't have the same level of healthcare resources, their numbers will be greatly lagging in terms of their accuracy.
Shifting gears just a little bit, can you answer the mask question? Are masks helpful to wear? I know in Asian countries it's common for the population to wear masks, and that's less common here. But what is the impact if you do wear a mask, and what kind of mask is most impactful?
Well, I think the recommendation from the CDC has been that unless you've been tested positive and known to have the virus, you really shouldn't be wearing a mask. The mask is really intended for those infected individuals not to be spreading the virus. And so you don't want a general population, because, for example, a general population who's, say, asymptomatic, but they want to wear a mask for protection. But yet if they touch a surface, whether it be an elevator door or a door handle or a cabinet top or anything like that, and then touch their eye, they can still get infected. So the mask only is to help with droplet spread from sneezes and coughs related to somebody who has already got the virus. If at all possible, Paul, I'd like to say just a couple more things. People are talking a lot about a vaccine, and I want to celebrate what's going on in this country, because the normal process of developing a vaccine is it's a multiple phased, multiple testing levels to get to a virus. It often takes 18 to 24 months or longer. I think what we're seeing is a great relaxation in regulations, allowing more expedient development of a vaccine. But I would tell you, a vaccine right now is probably on track to be at the very quickest 12 months, but maybe 18. But for us, that's extremely fast. So I want people to understand there's lots of innovation going on in our country. There's also a very strong desire to lessen some regulations to try to speed up access to a vaccine. The second part of that comment I wanted to make was, like for the flu, we have a drug called Tamiflu, which helps to quickly reduce the symptoms. There's been a lot of conversations out there about some anecdotal stories that came out of South Korea related to taking chloroquine, which is a common drug for malaria. And I will just tell you, chloroquine with zinc and chloroquine with zithromycin are currently two partnering drugs that they're being looked at right now in multiple studies that are disparate studies looking at different populations. And hopefully, if those studies start showing pretty significant success fairly quickly, those studies will be aborted and they'll move on into using those drugs. That could be, if those studies do show positive effects, that could be more of a Tamiflu drug for us, and those drugs are readily available now and would not be an issue to get.
Makes sense. Thank you. One last question on the topic here would be later this week we're supposed to see temperatures of 87, 88, 90 degrees. What will the Texas heat mean in our fight against COVID-19?
Well, I guess we're going to find out here pretty fast, because I think it's supposed to be up to 88 tomorrow. Unfortunately or unfortunately, I don't think we really know yet. We know that with other corona-related type viruses, there was some decrease during the hot weather. I think if you look at the viral outbreak curves that we saw in Italy and Canada and Iran and China and South Korea and others, you see there's a lull in the middle, and there's always a second spike. I don't know if that lull for us is going to be tied to heat, or if it's going to be tied to more of this confining folks for a little while to try to break the person-to-person spread. But we certainly can hope that it's got a temperature sensitivity to it. And I think the other thing to remember, though, is in the fall we could have a resurgence, but I would not think at all to this level at all. And we, by that time, would have other ways to mitigate it as well.
Right. Well, thank you for that information and for the update overall and for your leadership in the community. We appreciate that. I'm going to shift gears and we're going to move into the primary part of our program, which are questions that were submitted by faculty and staff across our system. And I'll start out with a series of questions that I have for all three presidents, and I realize there'll be some form of overlap in your answers, but if we can just attack them in an order where President Smatresk, you can go first, and President Mong, and then President Williams with these questions that were submitted that are applicable to all of you. So start out with President Smatresk here. What will happen if someone from UNT tests positive for COVID-19?
Well, I think the first thing that you should know is from a university perspective, we're down to skeleton staffing at this point. So from an essential services perspective, nothing would happen. The rest of it would be probably best addressed by Dr. Williams. I'll simply say that if anyone on our campus tests positive, we'll do everything we can to make sure that they get appropriate care, obviously isolation and identification of those who they came into close contact with would be mandatory pieces of our response. And we would do the best that we could to make sure disinfecting procedures were in place. Now, that's a very sketchy answer, and I actually think we're also going to be guided by what the local health department tells us to do, because they are the authorities in charge in situations like this. I think it might be useful to hear from Michael because he would be up on the details following that. I think you'll probably have the answer that all three of us will use. There won't be heterogeneity in our response.
Sure. Dr. Williams, you care to elaborate based on Neal's comments?
Well, I think Neal hit it with the isolation piece. I think, this is again, I want to remind everyone, this is a process that's going on, and we're evolving almost every day in terms of where we are on this. I think one thing that we've all done is send people home. And so that begins to help mitigate the risk. I think the second thing is if one of our team tests positive, if this has been a week ago and maybe still this week, the CDC recommendation would be just go home, stay confined at home, keep your family with you, and you should stay there for ideally the full 14 days. There's another recommendation out there that if you develop a fever, you wait until you're fever free for 3 days. And you wait until you've been at least 7 days since the start of the symptoms. But I think where we are now is with testing getting more and more readily available, we'll be observing and watching the CDC recommendations about sending them for testing. At first, all testing was being sent to the local public health department. As you can imagine, they quickly became overrun. As more testing centers come online and more quick tests come online, it would shift to an opportunity to have immediate testing. So we're kind of in this place right now where with limited testing resources and waiting for the supply chain to get established, we're telling people if your minimum symptoms are fever, dry cough, and maybe some mild shortness of breath, but not anything significant, stay home and take over-the-counter treatments and keep your family with you. Don't let your family go out and contaminate more. You do need to let somebody know your symptoms so that can be expanded to other people that you are around. I don't think it's much longer away from just maybe days that we'll have adequate testing for everyone to get tested as needed, everyone who's in that risk, that symptom, showing symptoms as well as the high-risk patients. I would also qualify that, say if they're one of our team members and they are high risk, they have a pre-existing respiratory disease or a cardiac disease or diabetic or their own cancer therapy or some other immunosuppressive type health issues, then they ought to get tested right away. And public health department will know most likely where the tests are going on. If there's any question, call your physician, your primary care provider, and almost all the primary care providers I know, certainly in Fort Worth and I'm certain in Dallas, have moved to virtual visits. And you can have a virtual visit and explain to your physician, who can give you more guidance as well.
A follow-up on the testing question for each of you. Where are we sending our faculty and staff and students, for that matter, to get tests? Where are we directing them? I believe UNT has capacity on campus. I'm not quite sure, though, if you guys could share where we're pointing people that need tests.
While we do have capacity on campus, I think our preference is that the appropriate authorities do the testing. The precautions that one has to take when opening up your health facility, which is also serving a number of residential students who are not protected with the full capabilities of a medical center, are tricky. And so in the effort to keep people isolated, we would ask them to go to like one of the drive-through clinics, or have someone from our health team provide them with careful advice. But I would prefer not mixing students who are getting routine health care in our health clinic with students who may be needing COVID testing.
Paul, we have sent at least one staffer to the Ellis Davis Fieldhouse near our campus, 9191 South Polk. They have a drive-through county-run center, and the American Airlines Center in downtown Dallas, you all know where that is also taking, and they're not, I think the wait's about an hour. So we had somebody go over there today, it was an hour, and so they're open and available, and they did lift the age ceiling. They lowered the age ceiling to anybody. It was 65 or older with a fever, but that's gone.
President Williams, anything different in Tarrant County that you'd like to offer?
No, I think what you just heard from Bob Mong was the fact that every test center is going to be different because their resource levels are going to be different, and how many people they can test. I agree absolutely with what Neal said. You don't want to be bringing those team members on campus for testing. Now that we have established test centers, again, I would contact your primary care physician, and most likely, if you're with a primary care physician, almost all of them are tied to some sort of health system network, whether it would be Baylor, HCA, Texas Health Resources, or Methodist, or others. And they will have test centers set up. Almost all of them do. Parkland has one as well that takes all comers in Dallas. In Fort Worth, we have opened one at an off-site location that the Health Science Center is sponsoring, and that one is specifically, though, exclusively for first responders in Tarrant County and the 41 cities in Tarrant County. So that's what I do recommend, Paul. I would not in any way, again, we're all going to be essentially down to no staff anyway on our campuses, so bringing them on campus doesn't make any sense anymore as it might have made sense 2 weeks ago.
Right. Well, here's a question, Bob. I'll start with you on this because you mentioned you had an employee tested, and your campus has not been closed very long. We did receive some questions from faculty and staff that were concerned if an area where someone who was tested positive may have worked was contaminated. What have we been doing on our campuses to make sure things are safe and cleaned properly?
Well, starting last week, we began deep cleaning all the buildings a couple times a day. Now, at this point, with no one on campus but the police department, there's limited custodial staff serving the police department at the campus and at the law school. So we went into a deep cleaning mode is what we did.
Anything different from your end, Dr. Williams or Smatresk?
We did the same thing Bob did. If we had an area, we have not had a for sure positive test on our campus before we went to sending everybody home. But if we had, we would have done the exact same thing he described with some deep cleaning at what we call a terminal clean as best we can. But fortunately, we did not have that issue.
President Smatresk, please go ahead.
I'm sorry. We would do the same. We haven't had a case on campus yet. I will tell you that as we close down residence halls and work to create a thoughtful resident scheme for the people who are still here, we will automatically go into a deep cleaning mode for every other facility so that we can kind of then lock the door and make sure they're in good shape should we need them for something else.
Got it. Thank you. I'm going to shift gears just a little bit and talk about academics, and I'll start with President Smatresk. Dr. Smatresk, you guys had a Herculean effort to take nearly 8,000 courses into online mode. How big of a challenge was that, and what will that impact the academic quality of what you guys are offering at UNT?
Well, the challenge was huge. I mean, try to imagine taking everybody who is midstream in their course material and saying, you're going to now use the tools at our command, Zoom, Teams, and Canvas, to create an online approach. The good news is we put out great training, and I'm going to give Provost Cowley a huge amount of credit for working really well with her team, and I'm going to give Adam Fine, our VP for Digital Strategy and Innovation, a lot of credit. They've moved to online. We launched the training programs with a trio of programs. Actually, we have Teach Anywhere, Learn Anywhere, and Work Anywhere. And so we offered both virtual tutorials, and way back when, we were offering some face-to-face for those who weren't able to learn effectively from the virtual, but that's all done now. It's all virtual. And those three programs that we stood up were effective at reaching virtually every faculty member and resolving their issues and challenges and letting them get up and running. And I think anybody who's been a university president, particularly in a really large university like we are, knows that you can measure the general satisfaction of students through the number of complaints that you get. I'm going to tell you, I haven't yet, and I'm knocking on wood, received one complaint from a student that they feel the courses or the course quality has been inadequate. Now, I'm not going to say that'll last. You've all been to college. You've taken courses that were better and worse from faculty who were ranged from brilliant to being very tough on people. But I right now feel that we have an opportunity to learn from this experience and to take whatever hiccups that we have and convert them into superior quality 21st century education. And we can be leading the state and the world in higher education online delivery because of this experience.
Dr. Williams, you have some unique challenges with your curriculum in graduate medicine. There's certain lab type courses, I imagine, that are very difficult to do from a remote location. How did you navigate those challenges, and how did things come together from your side of things?
Well, much like Neal described, our team did a fantastic job. Under the leadership of Provost Taylor and our deans, our faculty worked through getting trained very quickly, starting several weeks ago, and we're able to move our educational delivery system to all online, with the exception of those courses you mentioned, Paul, and some of those are related to competency tests that have to be in a practical exam format where the student is present with maybe a model patient or others. And our first priority was to make sure that all of our students across campus who had the ability to be eligible for graduation, we could focus on getting that done. And we were able to get that done so that all of our students will be okay in time for graduation. The other thing our deans did was they were very proactive and innovative in looking at those students who had options for elective courses, that we could set up some ability for them to get credit through some of the volunteer work that many of them were more than willing and wanting to do to help them finish out their coursework as well. And then we've worked with our hospital partners, which created another challenge because obviously with them canceling all elective surgeries in all the health systems, which is one of their key revenue drivers to make room for other COVID patients, as well as the strains on their resources, we've been good partners with them, and they said, we really got to focus on this right now. So some of our students were asked not to come back for rotations right now. Other students, for example, I know one health system that wanted our pharmacy students to continue because the workforce piece was very important for them. So it varies from point to point, but we've been working hard. Our team's been working hard to make sure after we knew our students could graduate, then the next one was to make sure that our next level students would be ready to proceed into next year's coursework by making sure they're prepared through the coursework now. So again, I applaud our faculty, our staff, and our deans and provost office for making sure this happened, and they got it done. And again, I said it earlier, I want to echo it again. Our clinical faculty moving all of our clinic visits to virtual was not a easy lift. That was a big lift as well, and it happened in a matter of almost just a few days. So I'm very, very thankful for our team.
And President Mong, I realize you guys just have moved into the online learning. How has the transition gone for you?
It's gone well. Our provost, Betty Stewart, Dr. Stewart, and the deans, Perez, Shumway, Hobson, Lacey, and Epps worked very closely together to go virtual. They work closely with Kevin Rocha in IT, our Dean of Students, Dr. Jamaica Chappell, and our Head of Student Success and Access, Stephanie Holly, and our CFO, Jim May. We're all involved, and it was a pretty seamless transition when you stop and think about it, much faster than I would have thought. We also have, set aside, we've done a good inventory of our laptop situation in case students or faculty need them or staff need them. So we have a good inventory on hand. We also reached out to our community. The North Texas Food Bank will be on campus for 2.5 hours next Tuesday morning from 9 to 11:30 to hand out food to students, staff, faculty if they need it, and we've invited the community. So our partnership mentality toward the community is also in play right now. So those are some of the things that we've done.
A question I'll start with Dr. Williams as our health expert. Best guess, do we think that summer classes are going to be similar, or is it up in the air? What are your thoughts there as far as the next go round on classes?
Well, one of the unique challenges we have is we have programs starting. We basically go year round without any real break, and so we have programs that are starting the day after the date of graduation each year, and so the plan would be to move and continue as many of those as we can on an online basis to keep things moving until we're able to come back and do a mix of on-site as well as online delivery. So with our planning that I described, we had to keep going and planning. For example, many of our clinical students would start rotations in the middle of the summer, and we have to make sure we keep on track with our hospital partners to be sure that availability will be there so that those students don't, in a sense, get backed up in their process. And for our non-clinical students, it's about opening the opportunity to get them back on campus to where they can resume their research projects or their other classes. One of our non-clinical schools is a school of public health, and they've had a long experience with online teaching, and I'm certain we'll be able to provide most, if not all, their curriculum online. So we'll just keep on going, and as I mentioned earlier, this thing is changing day by day, and I think we're going to get to a place where we turn the corner, and it's going to start getting a lot easier to deal with.
Absolutely. I'm going to segue into some questions that are specific to President Smatresk here in a moment, but I did want to ask each of you about some tough decisions that maybe you've had to make. Commencement being one. Can you guys share your status on your commencements? And also the other tough thing that has been a question is, how do you handle refunds for, this is more applicable to President Mong and Smatresk housing and whatnot. Bob, let's start with you. Tough decisions, commencement, refunds, those types of things. Can you share what that's been like and what you've announced?
Yeah, we haven't announced anything yet. We told the community we'd make a decision by April 1st. the difference being between cancellation and postponement. I'm talking to Pastor Rush at Ibach Church, where our Southern Dallas graduates attend for commencement. And Dean Epps has been in touch with Majestic Theater, where our College of Law graduates. And so we've reached out, and so it'll either be cancellation or postponement. We've gotten a few letters from law students asking for postponement. I understand that. It's just a matter of reaching a final decision and sticking with it. So I obviously lean toward postponement, but we haven't made a final decision yet. What was the other question?
Related to some financial
refunds?
Decisions.
Yeah, on refunds, yeah, we're prorating all in our residence hall. We're refunding them. We're refunding their food plan. We're putting the final numbers together on commuter food plans, and we'll refund those. And we're looking at what the right thing to do is for our parking passes at about perhaps a 50% refund. That's kind of where we are right now.
Dr. Williams, can you share any updates on those fronts, commencement or other tough decisions that you've faced and had to make?
Well, I think our commencement, our team, Student Affairs and others are assessing commencement. We know, or we felt pretty confident almost 3 to 4 weeks ago that we could not handle a convention center style commencement because we wouldn't have control of international and other domestic travel from places where the COVID-19 was more prevalent or positive. I think we're looking at other models. We're looking at a virtual graduation. We're looking at several different options, and we can be back to you about that a little later. But we have not made a final decision on what format we'll follow on that. If Paul, if I may, just for a second, take advantage of this question to talk just for a second about our team and some of the challenges we've had, but also how they've addressed those. First of all, I talked briefly about our team rallying in a tough situation where we recognized that Tarrant County did not have a first responder test site. It was dependent on the hospitals. We wanted to help our hospital partners by pulling off the first responders, so we opened our own test site. And I've got to celebrate our clinical team under Mark Chasse and the work that they've done to get that up and going. And we tested 12 first responders yesterday, and they were expecting double digits today. Second of all, our public health department set up a call center and got overwhelmed, and they reached out to us to see if we could help them. And we had an overwhelming number of student volunteers. And so this is back to challenges. How can we help them? And we established a call center in a matter of just a couple of days under leadership of Noah Drew and in our advancement office. And the very first day, our students handled over 1,000 calls. And so we're addressing these challenges with the county in more of a partnership perspective and the city and the other cities around. We've also made a significant donation to United Way to help them with their access for already people who are unemployed, for rent and for food, as well as some support for our students in our student food pantry, because we know we have students who are very vulnerable to lack of food and other essentials, really. I think the biggest challenges I see right now are all of us are committed, I think, trying to keep our teams working as best we can in an environment like this where we're not all together. But more concerning for me is the challenge of the mental health aspects that we're going to see. We're already seeing, if you saw the news yesterday in New York about some suicides, I think anxiety, depression is something we've got to pay a lot of attention to, and anxiety, depression in our teams. And as a result of that, I really want to come forward with, at this point, in terms of addressing that challenge from the perspective of have a message of hope, a message of trying to lessen fear. This will end, and it may become a virus we deal with every year, but we'll have a vaccine and we'll have other treatments for it. I think we need to, as leaders, need to lead with a voice of optimism. But in a time of uncertainty drives fear, and when you have fear, you lose hope. And so I'm here wanting to be. To me, my biggest challenge is to elevate hope and optimism, and to try to, as best we can, mitigate and tear down fear so that we can continue the attitudes and what I'm seeing at a local level is just like this amazing way of how we work together.
Yeah, no doubt. President Smatresk, let's move into some questions specific to you, but before that, wanted to get your take on tough decisions. And I know you've put out some announcements about commencement and some refund type things. If you can share those, and then we'll move into some questions that I got specific to UNT from faculty and staff.
Yeah, I'll move through these pretty fast. First, we've postponed our commencement till August. If the situation hasn't resolved, then we'll roll it into our fall graduation ceremonies, which will mean we extend from 3 to 4 days, or maybe 5, and that's okay. We think every kid deserves a chance to cross the stage, hopefully to shake a hand and to feel very good and celebrate. We have an average of 9 family members who attend graduation. We have a lot of first-generation students, and we want to make sure that they feel they've been fully celebrated. We've talked about virtual graduation, and I will tell you, the students didn't seem to much like that idea. So we're going to go with a live opportunity, albeit delayed. As far as summer classes go, they're primarily online. We'll move all of them online if we have to. We'll play it by ear based off what the guidance is at that time. As far as a couple sensitive issues, we know that there were a lot of students who have interrupted their residence hall and dining experiences here on campus. They are getting refunds that are effective on the date that they leave. Those students will get reimbursement for their residence hall and credits for dining in upcoming semesters. Finally, one of my big concerns is that many of our students work, or at least they did. And now that we have a number of students who are out of work because they've been displaced by the small businesses and the shelter-at-home situations that we're facing, we know that there's going to be a huge economic strain on them to be able to make tuition payments and other types of financial obligations that they have. So we are working hard. We've just launched with our alumni a campaign and an appeal to help support our students with an emergency relief fund. I have contributed to it personally. I will just tell you that we're doing what we can to make sure that our students know that we're caring for them. And we've delayed the payment deadlines to the end of the semester that were normally in place. And we'll consider at that point what we have to do to make sure that while people are sheltering at home and sheltering in place, they're able to learn in place. And this is something that we think is very, very important.
Have you added that relief fund to your website? I'm sorry, I don't know that people if they wanted to make a contribution, how they might do that.
We will make sure it's added to our website so that people can click a button and make donations to help support our students. Everybody who is a student knows the challenge that we have and what it takes to stay in school while you're also trying to work. So I hope people who have the capability of doing it will open up their hearts and open up their wallets and support our students.
You guys are unique in the fact that you still have students in residence halls. Bob has closed the one residence hall on the UNT Dallas campus, and HSC is not a residential campus. So what challenges are unique to that? And specifically, we had a question from somebody that said, isn't this dangerous for everyone on campus to have the residence halls open?
Well, people live here. They have no other living option. So if we have international students, or there are actually students who don't have family options, or students who in some cases are here because of travel limitations from other states, and if they choose to stay here, we take care of them. They're part of our Mean Green family. And so we take all the precautions that we can. We follow social distancing as best we can with a young and spirited population. And we make sure that they have a lot of options for social distancing around dining. For example, we have grab-and-go dining for them. So we're doing everything we know how to make sure that the people who are residential on campus are well cared for. I think in some cases, it's safer to be getting food from us and on campus than it might be to be out in the public in general, where there's no control on most of the infection attributes and capabilities that we have here. So a lot of people have asked about inbound mail delivery. I will simply say I have Jim available in the next room, and we will be continuing to deliver mail, although there may be a central pickup site, because we have a number of research activities and a number of critical activities plus checks that come in, and we need to make sure that we can continue to process them. As far as UNT leadership taking, one of the big questions that has been arising is, how are we ensuring the safety of staff members who are reporting to work? Right. And I think the right answer is that we're taking every measure that we can to make sure that social distancing protocols are being followed and that folks are working in a less densely populated environment that they've had in the past. And we simply say, if people don't feel that this is going on, I encourage them to contact the vice presidents of the units or divisions that they work with, and we will take extra steps. We know that not all of our staff and the folks who are here are equally educated in what social distancing means, and we're trying to make sure that they get access to the guidelines and that their supervisors are reinforcing those. Finally, we had a fun question. Someone wanted to know if we might consider making medical equipment that's in shortage from our Center for Agile and Adaptive Additive Manufacturing using our very advanced 3D metal printing capabilities. Now, I haven't been able to get a hold of them yet, and I'm not sure that that's something we can knock out. However, if there are parts or things that we can do that make it available and still provide reasonable safety, we would like to help as much as possible. We would like to be part of the solution, not part of the problem, for how we can help enhance healthcare on a state and regional level.
That's fantastic. And before we move on to Chancellor Roe, President Smatresk, I just wanted to share that I've been on some morning calls that Steve Marashevsky has led with our institutions, and it was pretty special to hear that the UNT community opened up residence halls to UNT Dallas students that may not have a place to stay. So I thought that was a pretty special collaborative effort that deserved a shout out. So thank you for that.
And before I vaporize again and turn off my video, I just thought I'd say a few things. First, there aren't enough thank yous for how hard the team's working. Second, mental health of all of our employees and our students is a key priority, and we're offering virtual counseling and virtual advising to help those who are feeling the need to talk to someone in sheltered or isolated situations so that they can be well and that we can emphasize their health as best we can, even though we're in this odd situation. Finally, the number of great stories, the number of inspirational people who've gone above and beyond to create dynamic learning experiences or to help their fellow Mean Green family members is overwhelming. And I'm going to tell you, every day we're going to be publishing up some of those stories, because in the midst of what can lead to what I call COVID fatigue, those stories lift me up. And I think the fact that we celebrate our faculty and staff and students who are doing amazing things and heroic acts of volunteerism with this Herculean effort is something that we should celebrate and something that unites our community during hard times. So thank you all very much for the ability to address these questions.
Right. Well, you couldn't have set the table better for a question that we received specific to Chancellor Roe. So, Chancellor, I'll ask you the second question on our list here that came in. Has there been any special recognition or thought of giving special recognition to individuals or leaders who have had to do things beyond the norm, had to stay on campus or work in buildings to help keep our facilities open? You know, these are custodial services, food services, facilities, our IT people who have been tireless as far as keeping our network up and running and making technology changes. Have you put any thought into any special recognition that you and the presidents might work on together?
Well, let's see. I think you heard loud and clear from every one of our presidents. Everybody has gone above and beyond. It's been an incredible effort, and we are so thankful to the work of each and every one of our team members for going this extra mile, thinking outside of the box, being agile and flexible, and really getting us where we are today. It is incredible if you think about what we've done in 2 weeks, I think it is now, to enable our students a path to continue their education online, to protect the well-being of our faculty and staff, and really to make sure we have continued operation. Largely while moving to remote operations, it has just been amazing. And I can't thank everyone enough for all of the work. There's so many unsung heroes in this, but I can't say there's one person that hasn't stepped up. And you heard it loud and clear from every one of our presidents. I give a shout out, but I'd have to give a shout out to everybody. I will shout out to all our first responders. We see that daily, how everybody is really going the extra mile there. Our healthcare providers, our custodial services. Clearly, the spread of this virus very much depends on our custodial services being excellent and really just going above and beyond. Our IT support. We wouldn't be having this town hall today without our IT support, and we wouldn't be moving to online courses without the incredible work of our IT team. There's just so many things. Our facilities teams, our financial teams who are behind the scenes working to make sure everybody gets paid, to make sure that we are just heroic measures to try to make sure that we're going to have what we need going forward. And our HR teams as well, student services teams really supporting our students coming back in very unusual situations. So everyone is just hugely thankful, and just I think everyone should, as you heard from our presidents, President Smatresk being the last one there to mention it, but really telling the stories. I think sharing some of the stories as we go through this would be wonderful. The good things that happen every day is well worth everybody touting. I think that's a lot of thanks to give to our people.
Yeah, absolutely. Look forward to telling those stories. And I'll just take a quick moment and say thank you to Jason Gutierrez and Chris McCoy and Brad and Aiden from my team for putting this together from a technical standpoint. And Chancellor, we had one other question specific to you before we move into some HR specifics for Barbara Abercrombie. And this is a question that you can't answer for everybody. I realize there's nuances at the universities, but the whole country is going to feel, the whole world is going to feel some financial ramifications related to this pandemic. How are we navigating things financially, and what do we expect to have to deal with as costs have gone up and revenues have gone down everywhere in the country, and our own challenges here in higher ed?
Right. Yeah. You heard from every single one of our presidents. There are impacts, definite impacts, some campuses greater than others, but I think the impacts are coming in all kinds of different ways. We're seeing, certainly we're providing refunds to our students, credits to our students, prorated. That already is over 13 million in impact and growing. We're seeing, depending on how long this continues, impacts, we're worried about impacts to student enrollment right now is big recruitment time. It's where we have a lot of future students all coming to our campuses, seeing our campuses. And so we're doing our best to really do those tours virtually and to reach out virtually. But sometimes it's just not the same. You know what you feel when you get out of our campuses. It really makes a difference for our students. They can feel how wonderful our campuses are. And so we're missing some of that right now. We're missing a lot of that right now. We have increased technology costs from moving our courses online. You heard that loud and clear from all three of our institutions. We're seeing impacts to experienced students' experiential opportunities such as internships, clinical rotations, those kind of impacts. Philanthropy, boy, with this uncertainty, people are nervous to reach out, and to give, and that's understandable during these really trying times. We're working hard to keep research on track, and I don't have tallies for all of these things, but I can tell you the impacts are significant. And what we're trying to do is really limit spending where it makes sense, delay non-essential procurements, put basically a soft freeze on our hiring, doing things that just kind of slow down some of the costs while we work through this uncertain time. And then, you mentioned about everybody's working from home now. We've needed to purchase laptops. You heard that. Train faculty and staff. All of that has driven some costs. But overall, we're thrilled how productive everyone has been with teleworking and have quickly adapted. And when we're using tools, like Microsoft Teams here and Zoom and other things that are really giving us the ability to see each other, to talk to each other, and continue working through problems together. I have no doubt we're going to see more challenges before things start to get to normal. But as President Williams said, we're going to get back to normal, and things are going to be okay. And so we're going to work through these challenges, and I feel certain that working together, we're going to be able to overcome every single one of them.
No doubt. Appreciate that message, and thank you for your leadership and helping us pull this town hall together and get everybody all in one place. The last segment of our program are some HR specifics for our Chief Human Capital Officer, Barbara Abercrombie. So if we can get Barbara to pop on her camera, we'll close with a series of questions for her. And again, we'll archive this video online. And if there were questions we weren't able to get to, some were pretty complex, know that those are on our radar to provide some answers by email. So thanks to everybody that sent in questions. And with that, I'll move on to some HR questions for Barbara. Barbara, are you still with us?
I am. I'm right here. Thank you so much.
Fantastic. Thank you for being patient.
That's not a problem.
So a lot of these are pretty specific, and they did come from faculty and staff. So I'll just run through them and give us your answer as best you can, please. The first one is a one that I hear commonly talking to some of the folks on my teams that are challenged with this is what are we doing to support working parents whose children are now home from school? Many of us are being asked to work from home, and we're also being asked to homeschool our children while doing our job. So how can we help those folks?
That's a really interesting component of the time that we're in is that, when schools close and we're asking our employees to work from home, it's really important that supervisors understand that we do have a flexible work schedule. So there may be times that, we are helping our employees with that through that flexible work time, so that maybe it's early in the morning that they're online, or maybe later in the evening, depending on how they can make that work. So I think that that's one of the really important things to keep in mind. Also, I think that some of the changes that came through with the House and Senate bill that was passed last week on some leave that might be available for people that are at home with kids right now, I think that Paul, your team has been so fantastic to help us with that. So we have information about those leaves online. You can go to our HR website to get that information, and we'll have a link available on our website so that you can see all the different scenarios. And again, there are some ways that can be very, very helpful for supervisors that are looking at employees that are really wondering, how am I going to balance all this? So there are some tools out there available for that. So that's certainly one thing that we really want to get across to our supervisors and to our employees.
Well, as you talk about supervisors and employees, that sets the table for this next question. President Williams talked a little bit about mental health, as did the Chancellor and the other presidents. What kind of training, if any, is being offered to supervisors to recognize and handle signs of distress or trauma in employees? We don't have that day-to-day contact, so maybe it's harder to get that. Are there trainings available to help our supervisors recognize someone may be in trouble?
That is why I meet with my leadership team every day, and I ask them to be on video so I can see them. And it's one of the things that, and Lisa does the exact same things with her leadership team. It's about having that face-to-face, even if it is through a video, where you really get a much better sense of how that person is doing. Even though we can't interact face to face, we can at least see that person online and get a sense of how they're doing. So that's certainly one thing that I highly recommend to all supervisors, is that make time to do these team meetings and Zoom meetings so that you really do get some interaction with your teammates that way. Second, this, funny enough, this town hall was actually originally supposed to be about our new well-being program. And with that well-being program, we were going to have one of our pillars is interpersonal well-being, and that is really all about what we're talking about. So we are going to move forward with our well-being program, and we will have lots of resources available for this type of thing so that our supervisors have some place to go. I think it's really important to keep in mind that our employee assistance program is available. They are doing phone consultations. They are doing video consultations. This is free for all of our employees. So please reach out to EAP if you're feeling stressed, or as a supervisor, use that as a tool to help your employees.
Well, you did a good job of answering about 3 questions in one, though. So I'm going to move along to what will be our final question, and understanding that there's some uncertainty, right, is related to working remotely. But employees are worried about how long they're going to have to work remotely and how long this is going to go on. What can you say to that, understanding we don't know quite where things are going to end?
We don't know, but we put out a memo on our website yesterday about some guidance around working remotely, as well as some guidance for our hourly employees and our student employees. I think that the thing that we know is that it's uncertain as to how long we are going to be in this situation, but really wanting to ensure that all of our leadership teams, from the system administration to each of our individual campuses, are really watching to see how long this is going to last, how long will we need to be working remotely, and to ensure that we are doing everything that we can to ensure that our employees are paid during this time. It is incredibly important that, as stressful as this is right now, that we're continuing to work. We still have lots of things that need to get done. We still have students that need support, and ensuring that our staff have work to do and are being incredibly productive so that when we're through this, that we can pick up as if we had no change in service at all for our students and for our faculty and staff.
And just one last item to address before we let everybody get back to their day. If a faculty or staff member have a specific HR question that we haven't answered on our website, FAQs and whatnot, what's the best way for them to get that answer?
Actually, that is a fantastic question. All of HR is fully functioning. So if it's a specific question about benefits, our benefits teams are all answering their phones, they're answering emails. The same is true for all of your campus HR as well. We made a decision not long after I got here that we would put everybody on laptops and do as many voice over internet phone systems so that we could really be as proactive as possible to ensure that if we were ever in a situation where we could not be sitting in an office, that we could still provide good service to the campus. So just understand that if it's not on the website and you have a question, start with your campus HR teams. They are there and ready to answer your questions. If it's a benefit question, go to your benefit team. They have done just some incredible work as you see the latest information coming in around the new leave that's been provided through with the House bill. The work that they spent over this weekend getting that information out there so that people could look at the scenarios and determine is really phenomenal. So a big shout out to Donna Shell and her team that have worked so diligently to get that information out there. So we are here, we are available, we are ready to answer your questions. If it's something you're not sure where it needs to go, send it to me. I will make sure it gets answered.
That's wonderful. And as we get ready to close here, I'll just share that for anybody within the UNT system, the UNT system website on the front page takes you a direct link to our update page that includes these HR changes and leave clarifications and Q&A. And there's also on the homepage of the system website direct links to each institution's COVID-19 website. So know that those are your go-to spots for a quick resource, and then follow up, as Barbara said, with follow-up questions. And with that, I'm going to conclude our town hall and just say thank you to Chancellor Roe, thank you to President Smatresk, President Mong, President Williams, and Dr. Abercrombie. We really appreciate your time during this very unique situation. And thanks to all of our faculty and staff that tuned in, and thank you for sending in questions. You are appreciated, and stay safe. Thank you.
Thank you, Paul.
Thank you, Paul.
Thanks, everybody.
Thanks, Paul. Great job.